Good afternoon, everyone. Getting ready to start. Just remember, if this is your first time with us, welcome. We're very much happy to have you. Remember to indicate your name and where you work and what category of staff you're, whether nurse, social worker, psychologist, anything, in the chat box so we can make a note of who all our guests are today. So again, thanks and welcome to everyone. This is a special HIV STI echo that's not dealing with HIV or STIs this time, but is dealing with something that's very topical. We just came out of one viral pandemic, and lo and behold, we get this new one, which will hopefully not reach pandemic status, we hope. No down or alley. And so as I put up in the WhatsApp group, a case has been confirmed in Brazil. It's kind of crawling up this South America. It was in Argentina, now it's in Brazil. And we know what these things, I remember there was a Far Side comic, for those of you who remember that comic, be a virus, see the wound. Viruses go everywhere, no matter how well we are, how hard we try to contain them. So this new monkeypox virus, even though it's not really new, but new as in terms of outside of these endemic areas where it usually happens. What do we need to know? How do we prepare? What do we need to look for when these cases eventually come to us? And we're quite happy to have Dr. Jeffrey Edwards, who's just to my left, who's going to give a presentation on this specific thing. Please feel free to ask questions. There's no such thing as a bad question or a silly question. And with that said, Dr. Edwards, over to you.
Okay, good afternoon, everybody. Thank you for joining this Zoom session on monkeypox. It'll be short, probably about 30 minutes. I actually gave this talk to the Medical Association last week. And a lot of the slides I got it from my CDC colleagues, so it's up to date. But as last week, I tried to update it again. All right. So let's get going. Okay. So in terms of the presentation, I'll do an introduction, the epidemiology, the motivation, clinical features, diagnosis, prevention, what clinicians need to know about monkeypox. Somebody not muted. Okay, so let's talk about monkeypox. Monkeypox is a viral zoonotic disease that occurs primarily in the tropical rainforests of Central and West Africa, and is occasionally exported to other regions, but we see more and more other non-endemic regions are getting it. The clinical presentation of monkeypox resembles that of smallpox, which is a related orthopox virus, but is very much more milder than smallpox. So mass vaccination occurred against smallpox, and then there was targeted vaccination and surveillance against smallpox. This resulted in the elimination of smallpox in 1997. And then WHO looked at it and they declared that smallpox was eradicated in 1980. So as a result of this, there's a subsequent cessation of smallpox vaccination. So people who are older than 40, 45, who are younger than 40 or 45 probably wouldn't have gotten smallpox vaccination. Go ahead, next one. So monkeypox has emerged as the most important orthopox virus, which is an envelope double-stranded DNA virus. Due to the absence of vaccine-derived immunity, they found that vaccination against smallpox somehow protected persons against developing monkeypox. Again, monkeypox is less contagious than smallpox and causes less severe illness. The natural reservoir of monkeypox is unknown. However, the animal hosts include a range of rodents and non-human primates, for example, monkeys, including rope squirrels, tree squirrels, the Gambian pouch rats. That's the rat you see in there on the screen, and the dormies. Next one. So monkeypox belongs to the orthopox virus genus, all right? And this also includes variola virus, which is the smallpox virus, the vaccinia virus, which is the smallpox vaccine, and cowpox. Monkeypox was first isolated in 1958, when it was discovered that there was a pox-like disease in monkeys kept for research in Copenhagen, Copenhagen, Denmark. So hence the term monkeypox, because it first presented in monkeys. In 1970, human monkeypox is identified in a 9-year-old boy in the Democratic Republic of the Congo. There are two clades or two strains of the monkeypox virus, the West African strain, which is a less severe disease, and then the Congo Basin strain, which causes more severe disease. So they have differences in pathogenicity. So since 1970, human cases of monkeypox have been reported in 11 African countries. And you can see them there. Nigeria is important. So looking at Nigeria, confirmed cases occurred in 1971, 2, and 1978. And between September 2017 and December 2018, there were 311 reports from 26 states in Nigeria. There were 132 confirmed cases from 17 states and 7 deaths. And the mean age of onset of the disease was 29 years old. And the largest outbreak of the monkeypox was the West African strain. Remember, that's a less severe strain. And with continued consistent reporting and confirmation of cases. Next one. So monkeypox has now migrated to non-endemic countries. In the US, in 2003, there was an outbreak linked to shipment of wild animals for distribution in the pet trade. There were 47 confirmed and probable cases. However, in this outbreak in the US, there was no human-to-human transmission. There were also 9 travel-associated cases from Nigeria between 2018 and May 2022. Of course, there's much more now. 5 cases in the UK, 2018, you can see 2, 2019, 2020, and 2021. 1 case of travel-associated monkeypox in Israel, 1 Singapore, and 2 in the US in 2021. However, even though these cases came from Nigeria on flights, there were no flight contacts. So people sitting down next to these persons with monkeypox in a plane, they didn't develop infection, indicating that monkeypox is not easily transmissible, all right? However, in the UK, 1 healthcare worker developed monkeypox from one of these patients, and 2 family members acquired monkeypox from these patients. Go ahead, next one. So how is monkeypox transmitted? Transmission occurs when a person comes in contact with a virus from an animal, human, or materials contaminated with the virus. So the virus enters the body through broken skin, the respiratory tract, or the mucous membranes. Animal to human or zoonotic transmission may occur by a bite or a scratch from an animal. If some people, if you prepare or ingest wild meat or bush meat, if they come into direct contact with blood or body fluids or lesion material, or indirect contact with lesion material, such as through contaminated bedding. So somebody monkeypox on a bed, the bedding becomes contaminated, and you come in contact with that. Next one. In terms of human-to-human transmission, this may occur either directly or indirectly with contact with body fluids or lesion materials, contact with fomites, for example, the bedding, or exposure to respiratory secretion. So some examples of high and intermediate risk exposures include shared towels and bedding. So the infectious body fluids and the scabs may be present on these. Skin-to-skin contact with a person who has monkeypox, or if you're inside a room or within 6 feet of a person with monkeypox and they're doing procedures that may create aerosols, all right? So if you're doing a procedure, a healthcare worker, and you should wear N95 mask, okay? Or higher, and you should probably wear eye protection. The good news is that monkeypox is not easily transmitted. So the folks from CDC have actually said they don't expect monkeypox to be the next pandemic because it's not easily transmitted. And it's been around since 1958 and 1970, the first case in humans. Next one. So in terms of the clinical features, The incubation period is between 6 and 13 days. It ranges from 5 to 21 days. And the infection can be divided into 2 periods. The invasion period, which lasts between 0 to 5 days, is characterized by fever, headache, swollen lymph nodes or lymphadenopathy. So swollen lymph nodes is a feature, a distinctive feature of monkeypox, and distinguishes it from chickenpox, varicella, or smallpox. In addition, they may get backache, myalgia, which is muscle pain, and fatigue or tiredness. Next one. Okay. And here you can see the lymph nodes in the neck of a patient with monkeypox. Large nodes may also be seen in the mandible, around the jaw, cervical, the neck, inguinal, in the groin, okay, in patients with monkeypox. Next one. And then after the initial phase, a rash develops, and the rash develops within 1 to 3 days of the appearance of the fever. Now, what I'm going to describe here is the classical monkeypox that is present in Africa. Later on, I'll tell you how monkeypox has atypical features. So the classical rash in monkeypox, all right, tends to be concentrated on the face and extremities rather than the trunk. It affects the face in 95% of cases, palms and soles in 75% of cases. And remember, if you see a condition affecting palms and soles, what do you all think?
Syphilis.
Secondary syphilis, all right? So that's why they asked me to talk about it, because the monkeypox affects the palms and soles, and STI is a big differential diagnosis. It may affect the oral mucous membranes in 70% of cases, the genitalia, as you can see, in 30% of cases, the conjunctiva, that's the eye, as well as the cornea, in 20%. Next one. So what does the rash look like? It starts off as a macule, which is flat, then becomes a papule, which is slightly raised, then becomes a vesicle, which is a fluid-filled raised lesion, a pustule, a raised lesion with pus in it, and then this crosses over and then desquamates, all right? So you tend to see these deep-seated, firm, well-circumscribed lesions with central umbilication, meaning there's a little umbilication in the middle, all right? And they may actually become confluent, joined with one another. The lesions tend to be of similar size and at the same stage, unlike chickenpox, where they tend to be of different stages, you know? So most of the lesions in monkeypox look the same, you know? And the rash is often present on the palms and soles. Pain and itching, pruritus is itching, may or may not be present. So the patient is infectious once the symptoms begin, so from the fever or the rash until the lesion scab and the scab falls off. And the number of lesions on the body varies from a few to several thousand. And just to show you here, you can see A here. You can see some slightly raised lesions. So there are some papules and vesicles being fluid filled. B and C, you can see these flat lesions, they're bacules, brown lesions on the palms and soles. D, you can see a pustule with a red ring about it. So erythema, the pustule and a halo, red ring around it. And then E, you can see it affecting under the nail. So this is called a subungual lesion. F, you can see it's a small papule. A papule is a raised lesion. G, you can see it started to become fluid filled a bit. So this is a vesicle. And then H is actually a deep abscess that was found in ultrasound. So they're going to drain it on ultrasound. Next one. Again, you can see vesicopustules with a red halo, a red ring around it. And you can see a little dot or umbilication in the center there. All right, and the other one is an umbilicated papule on the lower part of the leg. So these are what monkeypox tend to look like. Next one. Again, you can see the different lesions. And if you notice the ones in the palms and on the forearms, most of them tend to be of almost the same size and shape, all right? Because they're at similar stages. And remember, unlike chickenpox, don't usually affect the palms, and so it may have 1 or 2 lesions, but monkeypox affects the palms and soles. Next one. And this one just shows some satellite lesions. So you can see a couple lesions where the blue arrow is radiating from the main lesion. All right. But monkeypox, the good thing is usually a self-limited disease. So most patients, the vast majority, symptoms resolve in 2 to 4 weeks. So not really a really serious illness. However, some severe cases can occur, especially among children, all right? And this depends on the extent of virus exposure, the patient health status, and the nature of complications. Of course, if you have an underlying immune deficiency, you may have a worse outcome. And the immune deficiency can be things like cancer and, HIV infection if you're not on medication. Vaccination against smallpox offers some protection. So patients who are younger than 40 to 50 years of age, all right, may be more susceptible to monkeypox because all persons haven't been vaccinated. Because smallpox was eradicated in 1980 and they stopped vaccination. I got it, so I'm older than that. So some of y'all, and you can tell it, you see the scar on the arm, that's how you can tell you had smallpox. Next one. Now there's some additional complications. As I say, these complications are rare. You may get a pneumonia, you may get dehydration, might affect the GI tract. You could get secondary infection, it could affect the eyes, it can affect the brain and cause encephalitis. It can affect the skin and may cause scarring, so you get these pock marks, and very rarely death, The extent of asymptomatic infection is unknown, and the fatality rate ranges from between 1% to 10%. 1% for the West African clade and 10% for the Congo Basin clade. All right, next one. In terms of diagnosis, so persons who collect samples from patients with monkeypox should use the appropriate PPE, all right? So ideally, you should sample more than one type of lesion, preferably from various parts of the body. So what you can do is vigorously swab or brush the lesion, all right, with 2 separate dry polyester or Dacron swabs, all right? One for preliminary analysis and one for confirmatory testing. In the US, they can identify the preliminary analysis that is an autopox virus. But for confirmatory testing, you have to send the samples to CDC and they will tell if it's monkeypox or not. So most of the states can do autopox virus, we said, so they know that, but autopox, as I said, could be smallpox, it could be varicella, it could be cowpox, not varicella, variola vaccine, or it could be cowpox. So after you collect the swab, you break off the end of the applicator, all right, into a 1.5 or 2 mils screw cap tube with an O-ring, all right, or you can place the entire swab in the container. And they suggest that you shouldn't add any viral transport media. You should ship it dry. As I say, monkeypox is usually diagnosed by PCR, usually at the CDC. A lot of the labs in the Europe can also diagnose it also. Next one. In terms of treatment, so many individuals infected with monkeypox have this mild self-limiting disease. So most people don't need any treatment. Most people get it and in 2 to 4 weeks, they're better. However, the prognosis for monkeypox depends on multiple factors, such as previous vaccination status. So if you had smallpox vaccination in the past, it tends to give you some protection against monkeypox, the initial health status, and if you have any concurrent illnesses or comorbidities. So the clinical care of patients with monkeypox should be fully optimized to alleviate symptoms, manage complications, and prevent long-term sequelae. And if there's secondary bacterial infection, they can treat it antibiotics as needed. In terms of treatment guidance for monkeypox, all right? As I said, most people, mild disease, they get better in 2 to 4 weeks. However, patients with severe disease, for example, if there's hemorrhagic disease, bleeding, or if the lesions join together, become confluent, or if there's some kind of infection, they may require hospitalization. So people who may be at high risk for severe disease are those who are immunocompromised for whatever reason, cancer, if you're on steroid therapy, pediatric population, so children, usually younger than 8 years of age, pregnant or breastfeeding women, or persons with one of the complications that I described earlier. So these are the persons who are at risk for severe illness. But just to say that most people get better, all right, in 2 to 4 weeks, most people recover, no problems. Next one. So in terms of treatments, now the US have actually stockpiled treatment for the orthopox viruses. So they have a drug, an antiviral drug called tecovirimat, which has been licensed by both the European Medicines Association and the FDA, all right, for treating monkeypox. Oh, sorry, it was developed for smallpox and licensed for treating monkeypox in adults and pediatric patients. So tecovirimat, again, CDC has that available. Cidofovir, which is a antiviral, again, it holds this expanded access, new drug treatment for orthopox viruses, including monkeypox and outbreak. We've used cidofovir in the past. And then there's a vaccinia immune globulin, which is licensed for by the FDA for the treatment of complications due to vaccinia vaccination. So if you get a smallpox vaccination and you have complications, you can use the vaccinia immune globulin. And this also holds this expanded access investigation, new drug approval for treatment of orthopox viruses, including monkeypox in an outbreak. So this is for these treatments are for high-risk persons, all right? Not available, the CDC has access to this. They stockpile these drugs. Next one. In terms of prevention of monkeypox, all right? So quick identification of exposures, contact tracing, you isolate the persons, all right? And you isolate them usually for 21 days, all right? To limit further spread. So we did this with COVID, and the persons who have were diagnosed with COVID, we tell them stay at home, isolate until they become negative. Usually with monkeypox, we isolate them for 21 days. We carry out community education. You try to avoid contact with animals or fomites that might harbor the virus. You need to train your healthcare workers and train people and reinforce good practices in healthcare facilities. For example, remember, hand hygiene and wearing the PPE, wearing the masks and stuff. And as I mentioned before, previous vaccination against smallpox was demonstrated through several observational studies to be cross-protective. As a matter of fact, some of the studies went as far as to say it was 85% protective against people developing monkeypox. However, remember we got these vaccine years and years ago, so the immunity may wane with time, all right? Also, if you've been vaccinated with smallpox, you may get a milder illness if you do get monkeypox. So smallpox vaccination tends to help, all right? Next one. Again, the US has stockpiled 2 vaccines, okay, for the prevention of orthopox viruses. There's one called Jynneos, which is an attenuated live virus vaccine. And this has been approved by the US FDA for the prevention of monkeypox and high-risk contact. So if you come in contact with somebody monkeypox and in the US, the CDC could give you this vaccine, Jynneos. And there's another vaccine called ACAM 2000. This is a newer smallpox vaccine and replaced the older one. Remember the one that they stopped years ago? Mm-hmm. And the US stockpiles this in case there's some biological warfare. So they have this live replicating vaccine available for immunization of persons who may be at risk for developing smallpox. So if you're working with smallpox or you're thinking that, there might be some biological warfare, the US has these vaccines stockpiled. Next one. So in terms of a situational analysis here, this was as of May 22nd, 2022. You can see 251 cases, but go to the next slide. So I actually looked at it, looked at the WHO site and the update, okay? So in non-endemic areas, so that means regions outside of Africa, they reported to the WHO as of June 8, 2022. So there are a total of 704 cases, all right, in the 18 European Union countries. Most cases were in young men who have sex with men. There have been no deaths. And the clinical presentation is totally different in non-endemic countries. Most of the cases tend to present with lesions on the genital area or around the genital area. However, transmission is not thought to be due to sexual contact. Transmission is thought to occur probably due to close physical contact during sexual activities. Outside of Europe, there have been 473 cases confirmed in non-endemic regions outside of Europe, in the Americas, Australia, and Asia. So a total of 1,100 cases in non-endemic areas. Those are areas outside of Africa. Go ahead. So what makes this 2022 outbreak so different? So what is different about it? There are a large number of cases in multiple countries outside of Africa. And some of the cases occurred in men who have sex with men. As I mentioned, it's not thought to be sexually transmitted. It's thought to be transmitted by close body contact. Apparently, they have two raves, one in Spain and I think one in Belgium. And people who came back from those raves, whatever raves are, you all people know it. You all younger people know it's a rave, right?
Yeah.
It's a big party. All right, good, yes. So there are two big, huge raves, one in Spain and one in Belgium. And people came back with it. All right, they came back with somebody MSN who came back from those things, came back with monkeypox. Now, what's also strange now, there have been reported cases in persons who have no travel history to countries where the virus is endemic. And in terms of how the rash and how it clinically presents, the rash still has the same appearance, but it now starts in the genitals and around the anal areas. I remember proctitis, which is inflammation, of the rectum. And sometimes it might not spread to other parts of the body. So as a result of it presented in the genital and around the anus, cases are now recognized in outpatient or STI clinics because you easily confuse them with STIs. They may have the fever and stuff, they may or may not have them. We don't know the reason for the unusual presentation at this time. So outside of Africa, a lot of it tend to present in the genital area and looking like a STI basically. Next one. So what they did was, so remember when we had COVID-19 and they had all these different variants, you had the Omicron variant, you had the Delta variant. How we knew what variant we had in Trinidad was they would sequence the virus, all right? And then they could say, okay, we have Delta now in Trinidad. So what they did was they had 13 viruses, 9 from Portugal, 2 from Belgium, 1 from Germany, and 1 from US. They sequenced it and they found that all the virus was consistent with the West African clade seen in Nigeria. Remember, the West African clade is the less severe disease. And they found that even though the virus is present in different countries, it doesn't seem to have mutated to a more easily transmissible form. So it's not as easily transmissible as COVID, all right? So West African clade, less severe, and it hasn't mutated to a more transmissible form. So which is good news for us. So CDC do not think it'll become a pandemic unless something happens here. Next one. So what clinicians, what healthcare workers need to know? CDC issued a health advisory on May 20th, 2022, advice for clinicians. So be vigilant to the possibility of monkeypox if a characteristic rash is present. Know that the rash is presented atypically different. It presents in the genital area, all right? So clinicians working in STI outpatient clinics may be the first to suspect monkeypox. Many patients have mild symptoms and it's easy to confuse with a sexually transmitted disease or with varicella. As a matter of fact, after I gave this talk last week, when the doctors called me, "Doc, this patient walked into my office, there's monkeypox." I said, "Send me some photos." The patient had chickenpox. So again, you can come. It's difficult to distinguish sometimes, all right? Varicella zoster, which is shingles, or varicella, which is chickenpox from monkeypox. But if you have a patient and you suspect obtain a sexual history, obtain a travel history to determine if they had any contact. So that patient was a young boy, he must be 12 years old, and 2 other people in the class had similar rash. So I said, well, you know, there's chicken pox, you know, okay? Obtain specimens, notify the Ministry of Health, and consider initiating contact tracing. So isolate, tell the patient to stay away and do contact tracing, and of course, facilitate laboratory testing. So what clinicians need to know in terms of treatment and prevention, all specimens reported outside of endemic areas to the WHO have been found to be the West African clade, all right? This is associated with milder illnesses. And because the illness is mild, supportive care is enough. So they drink fluids, isolate at home, take Panadol if you have fever, and you know, you should be fine. If there's severe disease, then the Ministry of Health will have to contact the CDC to get those antivirals that I mentioned, all right? In terms of contacts, you should monitor healthcare personnel should monitor the contacts and monitor them for 21 days. There's something called post-exposure prophylaxis. So if after you've been exposed to monkeypox, the US has those 2 licensed vaccines that I mentioned before, again, only available from the CDC. And if there's something called pre-exposure prophylaxis, so people who work with smallpox and stuff normally get vaccinated against smallpox using that new vaccine that I mentioned, and that is called pre-exposure prophylaxis for certain healthcare personnel, all right? So those are my references, and if there are any questions, I told you it'll be 30 minutes, so any questions anybody want to ask, feel free.
Do we have the labs to do the confirmatory PCR in Trinidad?
Right, so they're asking about the lab. Unfortunately, so when we collect samples, we probably have to ship the samples to CDC, because we don't have the PCR tests available to do it. A lot of in the States, in the US, can't do it, they have to ship it to the CDC. Yeah.
And do you think it is recommended for persons under 40 that they get the smallpox?
The thing about it, the smallpox vaccine are really available again. They just, the US have these things stockpiled. So there's no widespread distribution of the smallpox vaccine because smallpox is eradicated. So they stopped making it. So again, if this outbreak turns out to be greater, then they may have to start considering, you know, giving smallpox vaccination, yeah.
So there's still investigations going on to see if it is sexually transmitted, because you're saying there's some cases that will turn up having this rash around certain parts.
Genitals, right? And they think it's from close
Contact.
physical contact during sexual activities. That's what they think, you know. They don't think it's actually sexually transmitted, but again, we're learning still, you know.
And a pregnant mother passed on to her baby.
Yeah, cases that a pregnant woman can pass it on to her baby. And persons who have been vaccinated with smallpox vaccine have come down with monkeypox, yeah? Because remember, the immunity wanes with time. So if you've been vaccinated 40 years ago, you know, the vaccine, the immune response to that vaccine mightn't be as good.
But in research, because you identify that, okay, persons with vaccination, it's difficult for them to get it. In their research, the age group that have been getting the monkeypox.
Yeah, but it's in young MSM. The young MSM is the ones who've been getting the monkeypox. Yeah, who of course unvaccinated. So the young MSM are the ones who've been getting most of the monkeypox now. And it's atypical. It's not presenting like what it presents in Africa. It presents differently. It presents on the palms and soles and genitals. So you're thinking of STI.
Please jog my memory. Chickenpox rash, do you get it on the palms?
You could get it, but not as common, yeah.
Not as common as
With monkeypox, you tend to get swollen lymph nodes, which is different.
Question from Sarah Sylvester. What is the likelihood of scarring after the lesion heals?
Yeah, it could cause scarring like chickenpox. You get these pockmark scars after they heal. So like after chickenpox, so chickenpox is a mild disease in children, moderate to severe in adults, and it causes scarring in adults. Yes. So this thing will also cause scarring in adults. Any other questions? Feel free.
Given that everything is opening up post-COVID, and especially for example, the cruise ship recruiters women right now, it's inevitable as it is going to spread worldwide eventually.
But it has spread actually, you know. You said Brazil identified a case, and there were 23 non-endemic areas, Europe and Asia, you know.
Right.
So I mean, it's spreading, but luckily for us, it's not easily transmissible like COVID. So they're thinking hopefully it wouldn't become, and then a significant amount of the population also vaccinated against smallpox. So, you know, hopefully it wouldn't become this pandemic. The people from CDC don't really think it'll become a pandemic because this virus, the first case was in 1970. Now, somebody saying something? Feel free to ask any question, anybody.
And if you can't speak where you are, feel free to type in the chat box as well.
Type it in the chat box. Cowpox, yeah. Cowpox was cowpox is a disease like chickenpox, like smallpox that affected cows. So how they first got that first smallpox vaccine, Edward Jenner, who was in the 1700s, he was a physician. He noticed that the milkmaids, the person who milked cows, they used to have these lesions on their hand, and they never got smallpox. So he thought, well, you know, if you somehow if somebody gets infected with the cowpox vaccine, it prevents smallpox. And he actually carried out the experiment unethically, and it worked. So that was the first vaccine ever where he carried out this thing. He injected somebody with cowpox, all right, and then 6 weeks later, he put some smallpox in them, and they never got smallpox. So cowpox is a similar vaccine, it's an orthopox virus. Similar virus, orthopox virus to monkeypox and smallpox.
But only
in cows, yeah. So humans will get 1 or 2 things on the hand, but not very serious, you know.
Question from Dr. Musa: any long-term complications like has been observed post-COVID-19 infection? So post-monkeypox, is there long monkeypox?
I don't know. We don't know yet. We don't know yet because, as I say, this only recently started in May. Actually, we started noticing all these cases outside of Africa. So we have to wait and see. Hopefully, what's happening. Again, most of the disease is milder, so in 2 to 4 weeks, most people get better. You know. People are asking, since it's similar to chicken pox, something could. The antivirals like acyclovir and stuff, but remember, this is acyclovir is for herpes virus. So the chickenpox is a herpes virus. This is an orthopox virus. So those antivirals already work against, you know, monkeypox. It's a different virus.
And so far, there hasn't been a big enough outbreak to, I mean, even though theoretically persons were immunocompromised, so far there hasn't been enough cases to see.
I know there have been enough cases, you know. I suppose if you look at the men who have sex with men, some of them might have had HIV, but most of the people on antiretrovirals, so the immune system tend to be pretty okay, you know. But they can't understand how come all of a sudden in this population, and people are worried that, you know, it may start causing stigma again, you know, because same like on HIV cause stigma in men who have sex with men, so we worry about that also. So they don't want to say it's only men who have sex with men because other people are also getting it.
Well, it already started on that.
I know it has started off like that. It has. So I know.
I've seen on articles where some gay men were actually bashed.
Right, so that's what I'm saying. Right, so that's what's starting to happen already, you know, and we don't really want that happening again. So again, but it's not only gay men have it, the other people getting it too, but it's because of those raves that they had that. I see Dr. John have up ahead.
Yeah.
Go ahead, Dr. John.
Hi, sorry, I'm not sure if you mentioned it, but is there any interaction between somebody who would have gotten like a chickenpox vaccine? How would they respond to getting monkeypox? Does that having a chickenpox vaccine prevent them from getting monkeypox?
Chickenpox is a herpes virus. It's a herpes zoster. Monkeypox is an orthopox virus.
Okay.
It's 2 different viruses. So
Okay.
what prevents smallpox is an orthopox virus. So the smallpox vaccine protects, chickenpox vaccine will protect.
A couple questions through the chat box. And from Tisha, I missed the beginning. However, besides fever and lesions, what are the other symptoms? Right?
In terms of the other symptoms, Dr. Boyce can also pull it up. So I mean, you have fever, the lymphadenopathy, the swollen glands, that distinguishes monkeypox from chickenpox and smallpox. And they also have the rash is kind of different. The lesions tend to look the same. So most of them tend to be the same size and shape, you know. Unlike chickenpox, where you get lesions of different sizes and shapes, and you know, so. And it could affect the palms and soles and the genitalia, all right? And so that's how we could distinguish it. So there's swollen glands, palms and soles and genitalia, and you may think is a sexually transmitted disease, so you have to screen for monkeypox.
We can do the screening test here in Trinidad.
Nope.
I know you told me for the confirmatory PCR.
No, we can't do it. Nope.
But even the screening test.
Because you have it's a PCR for the autopox, yeah. We don't have the PCR available for
Our
autopox.
doctors just have to go clearly on symptoms.
And take a swab, and hopefully we could send it to the CDC for them for confirmatory testing, you know? Yeah.
Question from Ms. Lavisty. Is it itchy like chickenpox?
They say it's not very itchy. It may cause pain and itching, but it's not as itchy as chickenpox.
And from Ilva Crooks, not sure if I missed it, but at what stage of the pustule formation is it most contagious?
Well, they say it's most contagious from the time symptoms develop until the scabs heal and fall off. So during that phase, you're mostly infectious. So that's why the skin-to-skin contact, or you come in contact with bedclothes or the clothes of somebody with those lesions, you can pick it up like that.
Is that the reason why they said 21 days?
Yeah, so they tell you stay on for 21 days because it usually heals in about 21 days, yeah.
But unlike with HIV, you can get it from shared towels.
Yeah, you can get from shared towels, yep, skin-to-skin contact, yeah.
So,
unlike HIV, yeah.
So if let's say a monkeypox case comes to Trinidad and Tobago and they're isolating at home, the person who's handling that person's bed.
I know you should use gloves and everything. Yeah, you have to use gloves and everything if you're handling all the bed clothes and stuff. Yeah. And probably wash it in hot water and stuff.
Because again, you said from the like things,
Yeah.
like kitchen things.
Yeah, fomites, yeah.
Things, yes, you have
Yeah,
to be
you
very
can get.
careful.
So you have to be careful, yeah.
Okay, for that HIV.
Yeah.
But yeah, because HIV don't spread like that, you know. Yeah. And again, they don't really spread via respiratory secretions unless you're doing some procedure on the patient, you know. Of course, animals, so be careful of the wild meat and thing you're eating, you know. Or cook your wild meat properly, you know. So any other questions? So again, monkeypox, as I say, people start everything now. People have shingles, they're calling saying, doc, I have this patient. They send my picture. So I said, but that's shingles, you know. So
question again in chat box from Ariana. That's knowing that there is monkeypox vaccine under development, can one take the smallpox vaccine in the interim?
I know, again, the smallpox vaccine is no longer available. It's only available stockpile in the US. And they have that for biological warfare in case somebody, you know, decide they're going to let out some smallpox. So they have that, yeah. So it's not readily available.
And question from Omari. Are there cases of reinfection in this latest outbreak?
Reinfection, I don't know, you know, I think if you get infected, it should give you some immunity. Yeah. So I don't know if you'll be able to get reinfected, hopefully not. But we don't know. Again, we're still looking and learning, you know.
Question from Sharon again. Do you think that severely immunocompromised client can be asymptomatic?
Right, that's it. They say that more severe disease tends occurring if you're more severely immunocompromised. So they may be asymptomatic, but they're at risk for more severe disease. So somebody who is immunosuppressed at risk for more severe disease. Immunosuppression could be cancer chemotherapy, you know, and long-term steroid therapy, you know. Okay, good. So that was good, folks. I mean, so we have to be vigilant. So if you suspect any cases, you know, you can feel free to send me some photos. I have a number of dermatology colleagues that we're trying to work together, and if we suspect any cases, you have to report it to the Ministry of Health, and that person should isolate, all right? And hopefully we'll do swabs to see if we can confirm it.
And in terms of the, I guess, case identification, you would expect this is somebody who would have a travel history or contact
Yeah,
with
so
somebody.
usually the person would have a travel history or contact with a patient with monkeypox, you know, or contact with animals, but I don't think we have those animals. We don't really import some of those animals in Trinidad, but you know, contact with animals also who have the virus.
So we should encourage persons, our clients and even staff to get the pneumonia vaccine. I saw bronchopneumonia is something there.
Yeah, but if there's any complications, I mean, we
Complications.
recommend you should get all the vaccines, but you might want to prevent from getting monkeypox. Yeah?
I know, but
Right,
just like a long
It might develop
something.
prevent the complications.
Yeah,
Yeah.
complications.
Yeah. So we wait and see, folks. We just have to wait and see. But as I said, people from CDC don't think it will become a pandemic because it's not a very infectious virus. And this has been, the first case was in 1970. I know that was 50 years ago. So, you know.
Yes.
Okay.
All right. So thanks a lot, folks.
Thank you very much, Dr. Edwards.
And again, thank you all for the participation and great questions. Remember, you are our ECHO family and make ECHO possible. And again, thanks everyone. Be safe, be well. Hopefully, we're not going to hear anything about monkeypox and tattoopox and quentpox. So hopefully, we'll look out for those things. Only monkeypox for now. Be safe and be well. And that's it for us at Mrftt, HIV, STI, and monkeypox ECHO. We'll see you in 2 weeks. Be great. Take care. Bye-bye.
Okay, bye-bye.
Thank you all.
Interested in
Yes.